everyone. I am Lourdes Jane Herdistar Noblas, a Level 1 nursing student from the University of the Visayas. And in this video, I will be performing my return demonstration for vital signs taking, which includes taking the patient's pulse rate. Vital signs are defined as the clinical measurements that indicate the state of a patient's essential body functions, whereas pulse rate is the measurement of the heart rate or the number of times the heart beats per minute. The 9 pulse rates are temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. The purpose and significance of taking the pulse rate is to determine the adequacy of peripheral circulation or the presence of a pulse deficit. First is to introduce yourself and verify the client's identity. Mayong adlaw, ma'am. Ako din si Jane, imong student nurse. Pwede ko mangutana unsa ganito'y imong pangalan, ma'am?
Mayong adlaw, nurse. Akong pangalan kay Solel Riego.
Salamat, Ma'am Solel. This is done to ensure that we are carrying out the correct procedure with the correct client. Next is to explain what you are going to do and why it is necessary. Ma'am Solel, magkuha ta sa imong pulse rate karon. Ato aning siyang pagkabuhaton aron ma-determinar ang adequacy sa imong peripheral circulation ug aron mahibaw-an nato kung anduna ba'y kakulangan sa pulso. Nakasabot ra ba, ma'am?
Nakasabot ra, nurse.
Salamat, Ma'am Solel. Providing information to your client will minimize fear and anxiety, will foster trust, and will promote cooperation. Next is to wash your hands or perform hand hygiene. This is done to prevent the transmission of harmful pathogens during the administration of health care. Next is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the area of the bed. If you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote client's comfort and cooperation. Next is to flex the client's elbow and place lower part of arm across his or her chest. This is done to expose the radial pulse for a more convenient palpation. Next is to support the client's wrist by grasping outer aspect with the thumb. This is done to assist the client into a more comfortable arm position while the radial pulse is being assessed. Next is to place index and middle finger in the inner aspect of the wrist over the artery and apply light but firm pressure. Fingertips are usually sensitive. Hence, they can detect the pulse better. However, we do not use our thumb since it has a pulse of its own which can be mistaken for the client's pulse. Light but firm pressure is applied because too much pressure can obliterate the pulse and too little pressure can make the pulse imperceptible. Next is to identify pulse rhythm and volume. our manner of counting appropriately and accurately. Now we can start counting using the second hand of our watch and count for a full minute. Counting a full minute will permit accuracy and allow assessment of both pulse rhythm and volume. Lastly, document the pulse rate results in the patient record. Documentation provides coordination of care and facilitates ongoing data collection. A well-written and detailed record of the patient will serve as a foundation for an efficient nursing intervention. Next is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the area of the bed. If you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote clients' comfort and cooperation. Next is to clean the earpiece and the diaphragm of the stethoscope with an alcohol swab. This is done to prevent cross-contamination and to ensure a precise and clear auscultation. Next is to raise the client's gown in order to expose the sternum and the left side of the heart. Ako ang sakay imuhang patient doon, sir, ha? Kaya expose ang imuhang left side sa imuhang chest. This is done to provide a better access over the apical pulse for a more convenient palpation in order to attain accuracy. Next is to locate the apex of the heart . This is done so that later on in the preceding steps, when you place the stethoscope at the fifth intercostal space, the heartbeat which will be more audible. Next is to inform the client that you are going to listen to his heart. Sir, maminaw ko sa imong heartbeat karon. Okay ra na nimo?
Oh, nice.
This is done to promote client cooperation. Next is to instruct the client to remain silent. Sir, ayaw sa lang pagstorya, sir, ha? When magdukol o escalation. Salamat, sir. This is done to ensure that the surrounding environment is free from noise and any other disturbance during auscultation. With your dominant hand, insert the earpiece into your ears and grasp the diaphragm with the other hand and hold onto it for 5 to 10 seconds. This is done to warm the diaphragm of the stethoscope, since the metal is usually cold and can startle the client when placed immediately. Next is to place the diaphragm of the stethoscope over the PMI and auscultate for S1 and S2 sounds. The heartbeat is usually louder at the apex of the heart. The S1 and S2 sounds or the lub-dub sounds is what we count to assess the client's heartbeat. Next is to note the regularity of the rhythm. The regularity of the rhythm reveals the pattern of time intervals between each heartbeat. This is done so that the nurse will be able to assess for any irregularities which may require the nurse to have a more careful assessment. Next is to start counting by looking at the second hand of the watch. Count one lub-dub sound as one beat and count for a full minute. Counting a full minute will permit a more accurate assessment of the apical pulse. One lub-dub sound is counted as one beat since each sound is produced at the beginning and at the end of one ventricular systole. Next is to share your findings with the client. Sir, imuhang apical pulse rate sir kay 77, which is normal.
Okay, nurse.
Salamat, sir. Sige, sir. The patient or the client is entitled to find out the findings since it is his or her right. This will also foster trust and cooperation in the implementation of the nursing intervention. Next is to record the findings into the patient chart. Documentation provides coordination of care and facilitates ongoing data collection. A well-written and detailed record of the client will serve as a foundation of an efficient nursing intervention.